I'm frequently asked, well, what is the difference between a partial and a total knee replacement? Well, it is exactly that. In a partial knee replacement, the surgeons are just replacing the inside part of the knee where the bone-on-bone arthritis is, and leaving behind the normal structures and the normal cartilage on the outside, the kneecap, and the normal ligaments. In doing so, it's a much less invasive or minimally invasive procedure to have a partial knee replacement. It's important to understand that a partial knee replacement does replace the entirety of the disease, it just doesn't replace the parts of the knee that are normal. So on the inside part of the knee, or the medial compartment, is the most common partial knee replacement that we see. It usually takes about an hour to perform surgically. And then the real big differences between a partial and a total knee replacement we start to see. First of all, the risk of significant complication after surgery is about 1/3 or 60% less with a partial knee replacement than a total knee replacement. It doesn't mean that there is no risk of complication. It simply means that the bad things that can happen much less frequently with a partial knee replacement because it's that much less of a surgery. So things like blood clot, infection, transfusion risk, even things like death and heart attack, substantially less risk with a partial knee than with a total knee. Number two, the recovery is usually much faster. It's a minimally invasive procedure to resurface the bad part of the knee, and therefore it requires much less rehabilitation. The physical therapy programming is the same between a partial and a total knee replacement, but the patient routinely will progress through that physical therapy significantly faster with a partial knee replacement because it is so much less invasive than a total knee replacement. And then finally, an issue of function. By preserving the normal ligaments of the knee, particularly the ACL or the anterior cruciate ligament, is preserved with a partial knee, and if it's present, it's taken out with a total knee. And the knee is much more mechanical with a total knee, whereas the partial knee replacement is much more normal. And so the function of the knee itself after surgery is much more normal. Patients can move faster, are able to do stairs and declines much better. They have better range of motion. They routinely are stronger with a partial knee replacement than they would be with a total knee replacement. And so again, the three very significant benefits: less risk, faster recovery, and substantially better function with a partial knee replacement. Well, what is the downside? Patients will routinely say, well, heck, if I'm having this surgery done, just do the whole thing. I don't want to have to come back. Well, what they're really saying is, what's the chance of revision? What's the chance of failure of this device? And when we've looked at our own series of partial knee replacements, of which we've done more Oxford partial knee replacements than any other practice in the world, we looked at our series and compared the Oxford partial knee to a standard total knee replacement, and we found the survivorship to actually be exactly equal. The chance of revision, the chance of needing another surgery at some time during your life, is about 1% per year. And that's a cumulative risk. And so the first year, that's a complication. You've had to have another surgery for some reason. But if you extrapolate 20 years post-op in any age group, there's about an 80% chance that you're doing fine and the implant's functioning great, whether a partial or a total. And so why do the whole knee replacement up front if the risk of revision is the same, but you have those three benefits that we talked about earlier?